There are 5 steps of rhythm analysis. Step 1. Calculate the rate. Step 2. Determine regularity. Step 3. Assess the P waves. Step 4. Determine the PR interval. And Step 5. Determine QRS duration. Let's dive into practical skills by determining the heart rate using a 6-second strip. To find the heart rate, count the number of R waves within a 6-second strip and then multiply that number by 10. Here's another illustration for practice. Start by recognizing the R waves within the 6-second interval. Tally up the total number and then multiply by 10. In this example, there are 14 R waves within 6 seconds, resulting in a BPM of 140. To determine if the ventricular rhythm is regular versus irregular, measure the distance between R waves with a caliper. A regular ventricular heart rhythm will have the same distance between R waves, while an irregular rhythm will have varying distances between them. When encountering an irregular rhythm on the ECG, as seen here, it becomes crucial to delve deeper into its pattern classification. You will need to distinguish whether it falls into the categories of occasionally irregular, regularly irregular, or irregularly irregular. Normal P waves should be present, similar looking, and occur at a regular rate as seen here. There should also be one for each QRS complex. As we've learned, the PR interval is measured from the beginning of the P wave to the beginning of the QRS complex. A normal reading should be between 3 to 5 small boxes. The last step in rhythm analysis is to ensure the QRS duration is a normal 1 to 3 boxes. So now that we know the 5 steps of rhythm analysis, let's put our knowledge to work to identify a normal sinus rhythm, also known as NSR. In an ECG showing an NSR, you will find the following criteria: heart rate between 60 to 100 BPMs, a regular heartbeat with regularity, normal P waves, a PR interval between 3 to 5 small boxes, and a QRS duration of less than 3 small boxes. Here is an example of an ECG showing a normal sinus rhythm. The rhythm is regular with a heart rate of 80 BPMs. The P waves are upright and regular, and there is one for each QRS complex. The PR interval is within 3 to 5 small boxes, and the QRS interval is within normal ranges at 0.08 seconds. Any deviation from this criteria is considered abnormal and is referred to as an arrhythmia.